you guys are going to have to move around. Just don't block the camera too much, okay? So I'm going to get up there in a minute. Okay. So basic thing with the neck at all times, if you consider the concept of relational motion, is the shoulder, the ear, and the chin, or basically the shoulder and any point you choose on the head, okay? So it can come farther away, okay? So you see how I generate side bending because her head is relatively pinned and her neck is relatively free. And then, you know, I can, if I'm just a jerk, I can wiggle her head all over the place this way. But the shoulder and the ear are coming closer together. The shoulder and the ear are coming farther apart, okay? Now, shoulder and chin, yeah, I can do it. Shoulder and chin closer together, shoulder and chin farther apart, right? So this relationship, I just think about chin and ear. That's what I think about. I don't care what point you use on the face. Just think of a point on the face or the head where the shoulder girdle can come towards or away from, or the part of the head can come closer to the shoulder, okay? So either this can stay still and this can move, or this can stay relatively still and this can move, or they can both move. Okay, so if we've got that as a fundamental concept, I come up here, I'll check rotation and I'll check side bending. Okay. So rotation, she'll go farther than this, but about here is where you would no longer like me to take you further, right?
Sure.
Right, like so if I, like it doesn't feel the most fantastic after that?
I don't feel anything.
Okay.
It's tight, but it's
Okay.
not pain or anything like that.
Okay, fine, fair enough. See, this is why you're careful about which feelings you ask about. Okay, and then this one, I don't feel any resistance. Do you agree?
Yeah.
Okay, but with respect to this, there is some resistance about here.
Yeah, it gets sticky.
Sticky, yeah. Okay, so at least we agree on that. All right, so we've got a finding in rotation. And it doesn't side bend particularly well to the right. Okay, so on the Friat model, that doesn't match. It should be rotation and side bending to the left that are bad. It is rotation to the left and side bending to the right that are bad. So it doesn't match that model. So now that model is no longer useful to me. Okay?
Aha!
Huzzah! Yeah, I talk about these things far too much. So if I'm going to go passive and I want to do rotation, the first movement is rotation to the right or to the left. That way, right? A rose by any other name would smell just as sweet. So what if I mess up the words, okay? So here, we're in here. I've got control of the head and the neck, and the hand underneath the head, the fingers are extended down into the neck. You agree?
Yeah.
Okay, so I've got some contact there. I can now use this shoulder to see if I get a little bit more movement, right? I don't necessarily get a little bit more movement without restriction. Now if I do this, pull it up, more movement with less restriction. You agree?
Yeah.
Okay, so that's the relationship I'm starting to work with. Put your right hand on your left shoulder. Yep. Yep. Okay, so that automatically lifts it off, correct?
Yeah.
Now, can I see, even though I'm not monitoring this side, it's not, I've got some resistance, right? Like, it doesn't feel bad to you, correct? But you agree that there's resistance now.
Yeah.
Okay, but now, if I do this, it works better.
Yep.
Correct? Okay, so I've got that.
You're slacking the...
We can talk about it that it's the slack, or we can just talk about it as positionality, because if I do this now, yeah, it does put tension into it. So that's pretty straightforward. It's more or less tension on the right side.
Yep.
Yeah, so it makes sense. But there will be times when it doesn't follow that pattern. Mm-hmm. So if I just teach to that pattern, I restrict you to that pattern, which is going to screw you, right? But now that I've got this, I can pull this up here, just leave that about there, so I get a little bit more movement. Now I can compress and distract. So if I compress, it just kind of gets a little jammed up. This isn't your most favorite, correct?
Yeah.
Okay. Now, in a strict technical sense, adding tension in the tissue should restrict motion, correct? Mm-hmm. Now, if I do this and I create traction, so my bottom hand is more or less surrounding the mastoid and the occiput. My top hand is just going to have good contact. You have to be careful, especially around heads and necks, more so necks, because sometimes people will use a little bit more lotion. Your hands may have a history of lotion today, right? So the stuff sticks around and you kind of get slippery, especially also in circumstances where even indoors it's a little bit more humid. You'll just slide a little bit more. If you have sweaty hands and they have a sweaty neck, you slide, right? So I'm going to create some traction. And surprisingly, that feels better, correct?
Yeah.
Yeah. So that is counter, okay? So if I push the shoulder down and it adds tension into the neck, it restricts motion. But if I bring the shoulder up and then I traction the neck, I get more motion in the desired direction, right? So I've tried compression, I've tried distraction, I've tried on the bottom rotation one way or the other, and then bringing the shoulder up and down. So I'm playing with that relationship more appropriately, right? So here we go. Now if I do this, jams it up, right? So if I create a little bit of extension, jams it up a bit.
Not so much.
Not so much. Not so much as the compression, but if
Yeah.
I do this,
So that feels more jammy to me.
really,
Yeah.
okay, doesn't feel that way to me.
Okay.
Your feelings matter more than mine.
Well, mostly it feels jammy on this side.
Okay.
Yeah.
So, but on the side that I'm trying to pay attention to, it's good. So I
Yeah.
like it. But it's better if somebody tells you that something is uncomfortable to them, because if they don't, they will protect themselves, and they should at all times, right? Just like in the octagon, protect yourself at all times, right? So there you go. Okay, come back, let the arm back to where it was more or less. Whee! Okay, so this was the good way. There goes my hand. Now, just a small note. That's not proper rotation, right? Because it's all over the place on axes, right? So I created some extension. Generally speaking, if you're in supine, you're going to create rotation. Your bottom hand has to kind of come under. You're trying to maintain a vertical axis, right? So here we go. This is the good way. Whee! Right? This was the less good way. Now that it's not that it's not there, it's qualitatively better and quantitatively a different position before I think I feel something. You agree with that?
Mhm.
Okay, sweet.